Hey, double hey, San Francisco Bay, Monterey. My name's Alex Andrew.
And I'm Dr. Shasta.
And we're here with another episode of Your Healthy Living. And boy, we've been having some fun this week, haven't we?
Yeah, we have.
You almost got me going there at the beginning of the show.
He's talking about the fact that I got the giggles in last show.
Dr. Shasta gave us her Achilles heel, so if you ever know Dr. Shasta, make her giggle for a little bit, and it just won't stop.
Once I'm not supposed to laugh, I can't not laugh. It's just horrible.
I know. That's weird. Is that like a syndrome or something?
No,
Has that been diagnosed?
I don't think so, but,
no? You're the
but I'm
doctor.
sure there's some people who'd like to label me with that, but whatever.
Exactly.
It's called growing up around a big dinner table where we were supposed to be quiet and a lot of really funny things were going on. And the more you're supposed to be quiet, the harder it is not to laugh.
I was just wishing you would have let me in on the secret because you were laughing over there and I kind of felt a little left out because I didn't hear the joke.
I hate to say you were the joke, but that's okay.
Oh, that's right. I was. Oh. Speaking of doctors, we have another doctor in the house.
We have my dear friend, Dr. Carla McClure from Joyful Life Acupuncture and Integrative Medicine up in, are you in Truckee?
Yeah, Truckee.
In Truckee.
Love Truckee.
And Carla is currently a doctor in acupuncture and Chinese medicine specializing in women's health with a focus in fertility and obstetrics with a second specialty in pain management and relief for any pain conditions. Carla has been practicing acupressure and massage and diet and nutrition for over 20 years and acupuncture for the last 7 years. She is credentialed at Tahoe Forest Hospital to provide acupuncture during labor and delivery, as well as in the medical surgical unit and the ICU.
Wow.
Yes, and I
awesome.
follow her on Facebook, and I see her out, on the front lines, helping patients with many different issues, from pain to nutrition, to fertility, to pregnancy, to postpartum. She is the old-time general practitioner, doctor, holistic doctor, and she's serving her community up there, and we're lucky to have her on the show.
I think it's beautiful. You got snow on the ground up there, right?
Yep.
Yeah.
Finally.
Yeah, I know it's been a real rough winter.
It's a little late in coming this winter.
Yeah, because we were kind of talking before the show, we were talking a little bit about Tahoe and Nevada. You're actually licensed in Nevada, right? And what do they call you in Nevada instead of
you're a doctor of Oriental medicine.
I love it.
DOM.
DOM.
Yeah.
And are you people come from both?
Yeah,
Nevada
people come
and
from.
California?
I actually have a lot of clients who come from Reno because it's a lot more expensive to get your license in Nevada, and it used to be much harder. The test used to be harder, and you used to have to intern, and another acupuncturist would have to nominate you for the test.
Wow.
Oh, wow.
And now they're making it easier, but there's actually in Truckee, North Lake Tahoe, we have like 20 acupuncturists.
Really?
For a population of maybe a total of 50,000 people. And in Reno, they only have 14 for a total of 500,000.
Yeah, so they probably needed to up the population of that.
Yeah, they actually have a shortage. And so I actually have clients who come from Reno. And even when I signed up for the test, I actually got cold called from Vegas and offered 3 acupuncture drops in Vegas.
That's really cool. I'm going to guess that skiers need more acupuncture than anybody else. Isn't that right?
You would think so.
That's the way it goes. Hey, we're going to be right back after this commercial break talking a little bit more with Dr. Carla McClure and all this awesome acupuncture stuff that I'm just going to listen in a little bit.
Okay.
We'll be right back after this commercial break.
At Way of Wellness, we help to rebalance the hormones of your body so that it can heal itself. Way of Wellness offers acupuncture, Chinese medicine, functional nutrition, chi yoga, and wellness coaching. Call 408-615-1995 and start living the life that keeps us well.
Hey, San Francisco Bay, Monterey. My name's Alex Andrew.
And I'm Dr. Shasta.
And we're back with Your Healthy Living on the KIYS Kindness in Your Soul radio network, talking with
Dr. Carla McClure.
Yeah, another acupuncturist is in the house.
Yeah, that's right.
I like that.
We did our doctorate together.
Oh, really? Oh, okay. That's cool.
Yep.
Yeah.
And she has a very unique situation that I've never heard of an acupuncturist having, where she's able to do work in the hospital during the labor and delivery. Most malpractices won't cover us acupuncturists
Really?
assisting labor, but she has managed to actually have that happen and be doing that. Which share a little bit about that, Carla.
There's a lot of the companies that insure the physician's malpractice for doctors are now insuring acupuncturists too, because more and more of us are working in hospitals, and they cover everything in the scope of practice without exclusions. So there's a company. So I did have to change my insurance to be able to cover active labor. So anyway, there was a doctor who wanted to have acupuncturists be able to work in the hospital and volunteer. So they had to get us credentialed. So it took her a few years to get it through the medical committee. And I set the intention in school that I wanted to get it into that hospital. And then a year after I got up here, I ran into her in the hallway randomly in front of the obstetrics department.
Wow.
And not randomly. And I said, hey, I've been meaning to email you. She said, great, we're on the agenda for the next meeting. They want an acupuncturist to come answer questions about safety and efficacy. And then she called me and said, we're getting 6 minutes. I'm going to introduce you. And here's the topics I want you to discuss.
Yeah.
And then they can ask questions, and the medical committee, that's their time. And so I went with Tyler Lapkin, who went to 5 branches and lives in Tawas City, and another local acupuncturist, Stephen Barr. And we did the presentation, and they unanimously approved us to be there. Now, they also, one of the reasons we got approved, I heard from the HR person later, was because many of the doctors knew both myself and Tyler personally, because we'd lived in the community and they knew us through other avenues. So they had a trust in us on a professional level and a personal level. And that's actually important in getting into a hospital.
I got to guess that's pretty unique. I mean, not all
Are
hospitals
there any other
allow
hospitals that allow
There
that?
are other hospitals that do have it. And for instance, Claudia Sikovitz in Brooklyn actually has an internship program where you can go as an acupuncturist and intern in both labor and delivery and the stroke clinic. And for a week and up to 6 months at a time. So they have a clinical internship. And I do know there's a couple of other hospitals, and probably some that we don't even know about, that have it. But a lot of them don't. Some of them will allow you to come in and do acupressure. And actually, Dr. Deborah Betts, who co-authored one of the books on pregnancy, first English texts on acupressure and acupuncture for pregnancy, says that the acupressure points are more effective for pain and labor than acupuncture.
Really?
So acupressure, you can teach anyone to do.
Right. That's right.
Your partner or a doula or the nurses. So I've actually, taught some of the nurses how to do it, and they totally jump in and go, okay, tell us what point to push.
That's great.
So the acupressure is actually 2 or 3, you kind of want 2 or 3 hands-on. It's a very hands-on pain management because you're holding it for every contraction.
Yeah, no kidding.
Contraction.
It's not like sticking a needle in that area and just letting it sit there and do the work.
So I do acupuncture for like failure to progress in the labor, or if the uterine contractions aren't strong enough, or if the baby turns from anterior to posterior position, we would do some points to get it to turn back over.
Yeah. I've done that before.
Really?
I've helped that happen before.
There's a lot of different, and then at the end for helping the placenta come out, you do a liver 14. But you can actually do that with acupressure too. So Claudia Sikovitz just puts her hand right in that point. And then I do points for postpartum bleeding, like spleen 1 and liver 1. And so I just kind of hover around and do whatever's needed, and then do maybe acupuncture points for emotional support. Like if the mom is getting tired or feeling frustrated with it, or how long it's going.
And what a great thing to have natural pain relief while you're going through.
Oh yeah, as opposed
labor.
to an epidural or whatever.
Right.
Yeah,
which they can, epidurals can damage the spinal fluid.
Yeah, you can get a woman through 12 to 15 hours of labor with the acupressure. And then they might choose to have an epidural more because they get tired.
Right.
Rather than because they're having trouble handling the pain. They can usually still handle the pain with the acupressure, but at 15 hours, your team is tired. You're tired.
That's what happened to me.
I
ended up, my
imagine.
son was 11 days late, and then they induced me, and then the pain was so intense from the Pitocin that there was no way I was going to survive without the epidural. And the epidural saved me. It was actually, I had a good experience. But
in some cases it's fine. But also with the Pitocin and those intense contractions, you know, I do ear acupuncture, like I'll put the tacks in so that I don't have to take needles in and out, and they just stay in through the whole labor and even through the postpartum period. And those help like with reducing the pain from the Pitocin. So we can work with, you know, even the medical
intervention. Really exciting, Carla.
The intensity. And
do the studies show that this helps decrease C-sections, having the pain be less?
The clinical trials show that even getting pre-labor acupuncture, so from week 36 on once a week to kind of get ready for labor, that actually reduces the labor by an average of 4 hours and reduces your pushing time by half. So even in the longer labors I've been in that were 21 or 24 or 30 hours, they were only pushing for like 45 minutes to an hour.
Right.
So, so generally it'll reduce it by an average of 4 hours, which, you know, could mean a lot of different things because every labor is different.
Yeah. Right.
But it does reduce the pushing time significantly.
Yeah.
And most of the women report that even getting pre-labor acupuncture, even if they're not having it during the labor, they say it helps them deal with the labor better and anything that'll come up in the labor, like complications, or even if it's a long labor, they feel like they can kind of roll with it.
Yeah.
You know, they're emotionally more centered and balanced and ready to kind of deal with whatever's
Man, I was lucky with my two kids. She was only in labor for, I think, 4 hours for one and 3 hours for the other one. So my arm was only getting ripped off for about a total of 7 hours after two kids.
Not bad.
But that's amazing that, you know, I think to somebody who comes from a family that's all medicine, you know, of course, you know, we grew up in the 60s and 70s.
And the doctors up here are super welcoming. You know, when I come in, they're like, "Oh, great, you're here." They're the Tahoe Forest Hospital, the obstetrics has been voted one of the top baby-friendly hospitals in the country, which they also encourage breastfeeding right away.
Wonderful.
Skin to skin immediately. Even if you get a C-section, they're doing skin to skin on the mom for at least 60 seconds and then handing the baby to the father, and the father's getting the skin to skin while they stitch mom up.
Yeah.
And the dad's in the room for the C-section. So they're really doing everything they can to ensure like best bonding for mom and baby.
Yeah. That's so great. You know, and the significance
in the same room.
And that's just amazing. And the importance of actual vaginal delivery for the baby's immune system with the bacteria that the babies get makes it so important that we have another way to reduce pain, induce labor, and natural childbirth for the protection and longevity of the child, getting the right bacteria from their mother.
Yeah, I tell you what, I would have, just listening to this, of course, I'm kind of the fly on the wall here, but how amazing would it be, not only for birth, but to really start to bring acupuncture into the emergency rooms, emergency rooms and
also,
so on and so forth for pain and all that kind of stuff.
And the opioid epidemic, oh my gosh.
We never hear about
acupuncture should be used for pain, because it actually treats the pain along with releasing natural opiates.
And that's why I was asking about the other hospitals that might, you know, have that, you know, acupuncture available. I know they just kind of, insurance started adding chiropractics and acupuncture and that kind of thing to their, you know, covered list.
It's actually been in the coverage for well over 20 years.
Oh, it has. Okay.
It has been in the past. When I was in college, which, you know, now that's 28 years ago.
Hey, hold that thought, Carla. We're going to be right back after we do this commercial break. I want to talk about some other specialties you got, because you got some really cool specialties in acupuncture. We'll be right back after this commercial break with Dr. Carla McClure.
I do traditional Chinese medicine, and that includes 5 different branches: acupuncture, massage, yoga, tai chi, qigong, herbal medicine, and nutrition. It is amazing in helping the body heal itself, that it releases the body's natural endorphins, serotonin, and seems to rebalance the hormones of the body.
Lower back pain was taken care of very quickly. 6 treatments and I was pain-free. And this was like 3 years ago, and I've remained pain-free.
I've grown up in the Bay Area, and I have had my own practice for over 15 years. When I was 12, I decided I want to be an acupuncturist, and by the time I was 25, I was licensed.
I have thyroid condition and stress, big time. When I walk out, I'm feeling like a whole different person. It's definitely a blessing to be able to come here.
I love helping women have babies, and the day that they actually get pregnant, the look in their eye is like, it's the best thing ever.
I've been struggling trying to get pregnant for the past 3 or 4 years. I came to Shasta. I would totally recommend her to anyone out there that is trying to get pregnant. She will do great for you.
Way of wellness has to do with living a life that keeps us well.
Hi there, this is Alexander with It's All About the Show. You know, I've been with Money Concepts since 1994, and they have been the primary catalyst for my success as a financial advisor. If you're looking for a career change and you want to help people for a living, check out moneyconcepts.com/ALEE or call 946-8378 today.
Hey everybody, my name's Alex Andrew.
And I'm Dr. Shasta.
And we're back with Your Healthy Living, hanging out with Dr.
Carla McClure.
And some really cool stuff on the acupuncture side. Growing up in a family, everybody's a doctor. You know, they didn't believe a lot. Of course, this was the 70s and stuff. Mm-hmm. But it's really interesting to hear some of the stories of dealing with women having babies and being in labor and actually figuring out how to make that less painful, and how, you know, in the hospitals and the insurance, you were saying the insurance has covered it for the last 20 years or so in general, right?
Well, they've covered it. I mean, that's insurance politics, but for instance, my dad's policy when I was in college covered chiropractic, acupuncture, and massage. They paid 80%. I paid 20%.
Oh, really? Okay.
And I had unlimited visits, but this was before we went to the HMO model,
right,
and some of these other models, which then started excluding stuff, right? So in the beginning, It was kind of all included. Then it started getting excluded again.
Right.
And now, you know, we're really getting squeezed, even though it's an essential healthcare benefit in many states under the Affordable Health Care Act. In California, Medi-Cal covers acupuncture in California right now. You get
really?
2 a month. They only reimburse up to like $37. However, you know, it is covered. So it's covered by a lot of things. With the labor and delivery, if you're having me there for the whole labor, then people are hiring me as a labor coach,
right? You
know, and paying me a separate fee. But some insurances do cover that too. I have one patient now where they said, yes, we would cover a doula or a labor coach, because studies have found that reduces the number of C-sections and medical interventions to have support during your
and
labor.
why wouldn't they do that? Cutting costs, you know, cutting costs for people, and you know, I mean, I gotta guess that doctors have just such a high workload that being able to pull that, you know, back a little bit,
having a baby,
save money.
The hospital will save money, but the doctor only makes money if he catches the baby.
That's true.
So usually they're only coming in to catch the baby, and that's fine, you know. So you know, if they're catching the baby, you're still there supporting it, but then they still catch the baby, so they make the money at the end.
Right. So
that's great.
You not only do you like deal with the women while they're in labor, you deal with the children after they're born, huh?
Yep. So I treat babies. We do a lot of, you know, Tui Na and Chinese style massage, but I also do acupuncture. And usually with the babies, you're just doing a quick in and out. And until they're 1 year old, they actually don't necessarily feel it, and they're really tuned in. You know, they respond really well to acupuncture. So helping with things like constipation, like if the baby's not pooping, because, you know, with the baby, it's like, is it eating and is it pooping and peeing?
Right.
Sleeping? And, you know, those things can have challenges. And it's really easy to treat with acupressure and, even gentle acupuncture, 1 or 2 sessions.
Yeah.
So-
I've taught some of my moms how to do that on their babies.
So we don't need laxative. We just need to know where to get poked when
Yeah.
that happens. Huh?
You help the body.
You can make a baby or a child poop within 30 minutes.
No kidding.
Adults within 60 to 90 minutes.
No kidding, huh?
Doing 2 needles.
Wow.
Stomach 25.
Yep.
That's
It's
crazy.
right here. Boink.
Oh my gosh.
Well, so do you also, I noticed that you do nutrition and herbs. So are you encouraging that with the children also?
Oh, yeah. Well, especially with babies, as you may know, when you're breastfeeding, they can get gas.
Mm-hmm.
And so a lot of times you have to eliminate certain foods, often dairy, gluten, even things like broccoli or cruciferous vegetables. Oh, we don't recommend onions and garlic. And then even coffee, like some women, especially if the babies are born a couple weeks early, they get acid reflux really easily. And coffee has a strong upward energetic component.
Right.
So while you may have avoided coffee during pregnancy or while you're trying to get pregnant, you also kind of want to avoid it until you stop breastfeeding. But you can test it out. And usually when you eliminate something, the baby usually responds within a day or 2.
It's just really amazing. So a lot of babies, they'll get this eczema and rashes, and it's usually from something the mother is eating, ingesting.
Huh.
And and the poor babies are they're miserable, and the mother's totally worried about their baby.
Their digestive system's new, right?
Yeah.
So it takes a couple months for them to, they've been getting everything direct from the blood, and now their digestive system was the last to develop, and it's learning how to digest food.
Yeah.
Right.
So you also do this scalp acupuncture, and you were talking about traumatic brain injuries, and we were talking about the football concussion stuff, that CTE that is very much known now. And would you like to share a little bit about how acupuncture treats that?
So I actually suffered a concussion myself in 1995 skiing.
Mm-hmm.
I had a glancing blow on C7 and occiput, and was out for 15 minutes. And it was a very interesting experience recovering from that. And diet and nutrition plays a huge role. Your brain runs on protein and glucose, and you need to eat like a zone type diet, like a really balanced meal with protein, carbs, fats at each meal. And it's the only time I actually tell people to eat sugar, because when your brain runs out of the glucose, you start to feel fuzzy headed, and you need to get some instant glucose. So they have those energy gels like goo, and that's been engineered to go right into your bloodstream. And I had talked to the inventor of that, who also invented the Power Bar. And when I had the concussion, I said, well, he told me it goes right into the bloodstream, and I would go get 5 goos and have them in one sitting, and it would clear my head up from front to the back.
Really?
So I use that with the patients. And then doing acupuncture and some of the herbs, we have a couple tonics, cerebral tonics, that people have recovered like from something where they couldn't sit at a computer screen and that was their job, and recovered in like a week or 2. Just getting acupuncture right away and helping them with their nutrition and doing some herbs. And up here, a lot of the kids are doing a lot more intense things, like the level of play and like soccer and lacrosse. And, up here we do a lot of skiing, and there's kids jumping off of cliffs, and, kids are taking it all to a much higher level of performance. And, that means there's a risk of getting your head hit. And of course, driving in a car.
Right.
Just even getting rear-ended and having your head go back and forth. You may not hit anything, but your brain hits your skull front and back.
Right.
So people come in and I go, oh, you have a concussion. And they go, no, but I didn't hit my head. And I said, yeah, but you have symptoms of a concussion. So that can range from, having a headache or visual disturbance to just being more irritable or short-tempered or not having as much patience or having some balance issues. And the scalp acupuncture, there's 3 famous doctors who brought the scalp acupuncture back, and that's Dr. Zhao and Dr. Zhu. And Dr. Zhu has a clinic there in San Jose, neuroacupuncture, and he uses a slightly different style and placement of the needles. But Dr. Zhao uses the classic placement, and he spoke at our doctorate program, of course. And he said, "Hey, you guys can all do this."
You know what? I used his technique for stroke.
Uh-huh.
And I had a patient who had an injury from what is it when you're on a zip line injury.
Oh, zip line.
And her hand was stuck like this and her foot was stuck, and I did his technique that he taught us, and her hand released and her foot went back to normal, and in 2 treatments.
Right.
It was
And
amazing.
Does that stay though?
It stayed.
Yeah, it does stay.
It stayed.
It stays. And the sooner you can get it, like with the stroke, if you can get acupuncture within 72 hours of a stroke, which is sometimes difficult in the hospitals, you can minimize the impacts of paralysis.
And it's used for Bell's palsy too. I'm treating a patient with Bell's
That's
palsy
so weird.
right now.
When I first saw SCALP, I was thinking I was going to be able to grow my hair back, but this is so much
It's
more
working
interesting.
with the brain.
Yeah,
Yeah,
that's
it's
so
working with
cool.
the brain. Because
Acupuncture
you're working
stimulates
over
it.
the centers of the brain. And so Dr. Zhao was actually, he was a brain surgeon at first. And then in the Cultural Revolution, they sent him to the countryside and they wouldn't let him do brain surgery anymore. But they let him do acupuncture.
Yeah,
and
his
so he's
technique
like,
is so
okay,
amazing.
I know what the brain is like.
Wow, that's so cool.
Then he had
brain
the
surgery with the needles.
yeah.
That's so cool. Hey, if somebody wanted to get a hold of you or touch base with you, how would they do that? Or is that something?
Well, I have a website, joyfullifeacupuncture.com. They can call me on my phone number. Should I give that?
Yeah,
If you want, that's
you
fine.
want to.
530-386-4851. You can text me, email me, and I also have a Facebook page, Joyful Life Acupuncture and Integrative Medicine. And yeah, if you Google me, you'll Truckee Acupuncture. I also have a community acupuncture on Monday nights.
Oh, wonderful.
Oh, neat.
So group
Great.
acupuncture. So that's under Truckee.
It's
Community.
wonderful to have you on, Dr. Carla.
Yeah, this is great.
Really wanted to share you
I'm
with the world.
so much more enlightened now about needles being poked into your skin.
Yeah.
Thank you so much.
All right. We'll see you later.
But take care. Everybody tune in to our website at KIYSradio.com and catch all the stuff on the Kindness in Your Soul Network, KIYS Radio. My name's Alex Andrew.
I'm Dr. Shasta.
Thanks for joining us on Your Healthy Living. Bye-bye.
Bye.